Bismillahirrahmanirrahim. Assalamo Allaikum. Welcome to our YouTube channel, The Vigour. Today we are going to talk on a very important topic, high blood pressure. High blood pressure known as hypertension also. In this session we will talk what is high blood pressure, what are the symptoms, what are the risk factors, what are the complications, and what are the treatment options. Viewers, if you are new on our channel, please subscribe our channel, press bell icon so you can get the notification of our new videos. Before going to high blood pressure, first we should understand what is blood pressure. Each time our heart beat, the blood pushed by the heart toward the body organs. The normal pressure is very important for the proper blood flow from the heart to the body organs. Blood pressure measured in two numbers. The one is systolic blood pressure and the other one is diastolic blood pressure. And the unit of blood pressure is millimeter of mercury. When our heart pushed blood toward the body, the pressure on our arteries is called systolic blood pressure. And when our heart relaxes, at that time the pressure of blood on our arteries is called diastolic blood pressure. Blood pressure recorded as systolic blood pressure or diastolic blood pressure means systolic blood pressure is the top number and diastolic blood pressure is the bottom number of blood pressure. The normal blood pressure level of an adult person is less than 120 or 80 millimeter of mercury. And if blood pressure is recorded consistently 140 over 90 or higher, that's called high blood pressure or hypertension. What are the symptoms of high blood pressure? There are no clear symptoms of the high blood pressure, that's why it's called silent killer. However, in some people, some symptoms can appear if the blood pressure elevated dangerously, such as blurred vision, headache, chest pain, nasal bleeding, shortness of breath, etc. What are the complications of high blood pressure? High blood pressure can damage our blood vessels and it can lead to heart attack, stroke, kidney failure, and vision loss. What are the risk factors? It can happen because of unhealthy lifestyle choices such as not getting physical exercise. There are some medical conditions like diabetes mellitus, obesity. There are some other risk factors also like tobacco, alcohol, stress, and the major factor of the high blood pressure is family history. Now let's try to understand the stages of high blood pressure. The normal blood pressure level is less than 120 over 80 millimeter of mercury. Elevated blood pressure or pre-hypertension is from 120 to 129 over 80. Stage 1 hypertension is 129 to 139 over 80 to 89, and stage 2 hypertension is 140 over 90 or higher. Hypertension crisis. When the blood pressure reaches to 180 over 120 or higher, that's called hypertensive crisis. In this condition, the patient must be moved to the hospital for the further investigation and for the management. What are the treatment options? Before going to the medication, I would like to say that if we change the lifestyle, it can make a very big difference to lowering our blood pressure. There are two things. The one is diet control and the second is physical exercise. If we do physical exercise 150 minutes per week, it can make a very big difference to lower our blood pressure. In the daily diet, if we reduce salt, sodium, it can also make a very big difference to lowering our blood pressure. There are a few things like tobacco, alcohol, if we reduce or totally eliminate from our habit, so it can make a very big help to lowering our blood pressure. There are a few things that we should add to our diet like nuts, fresh fruits, vegetables, and if we reduce our blood pressure just by 5 millimeter of mercury, we can reduce the risk of stroke by 34%. In some cases, even with the lifestyle changes, the blood pressure is not coming to the target level. So the patient must see the physician and to take the proper medication. That's all for today. Viewers, if you would like to see the video regarding the high blood pressure patient's diet, you can see the video. See you soon, inshallah, with the new video. Till that time, take care. Allah Hafiz.